Great. Let me just introduce the next panel and the moderator. The next panel is Pragmatic Approaches to Breach Prevention and Management. And the moderator, Kevin Stein with the National Institute of Standards and Technology, NIST.
I appreciate it. Oh, we're on. And thank you for joining us today on another beautiful day in the DC area for such an important topic. So as kind of lay out in the session abstract, breaches are occurring, they continue to occur, increasing the frequency of these on a very regular basis. And they have an impact on an organization's ability to deliver their services, to develop their products, to establish relationships. It really impacts the objectives of the organization from a mission and a business perspective, and that's certainly the case in the healthcare space as well. And kind of pulling a theme from some of the previous panels, it really does impact kind of the perception or the reality of trust in that organization, from their customers, from their clients, their patients, their other stakeholders, maybe other government agencies, other parts of industry as well. And as we see almost on a daily basis, these types of breaches are impacting many sectors. Certainly, if you think of the government as a sector, we had the opium breach in the not-so-distant past. Definitely in the healthcare space, we hear about breaches on a regular basis. This morning I was reading about a breach at Wendy's, kind of a point-of-sale attack through malware through their systems that were impacting a certain percentage of the Wendy's installations across the country. So nothing is safe if Wendy's is not safe. So the plan for this panel is to really, kind of tap into the expertise of the folks on the panel to really understand, what are some practical approaches or lessons learned from past breaches, past incidents that we can share with you today. Our plan in terms of the flow of this session is to give each of the panelists about 5 minutes of opening remarks. Some have slides and some multimedia to kind of walk through those. And then we'll open it up to questions. I certainly have a few questions to throw to the panel, but I definitely, there's a mic here in the front that it's getting lonely from the last two sessions. So definitely invite you to think about questions that you may have for the panel and encourage you to come up and ask those, obviously time permitting. So with that, we'll go ahead and open up. Our first panelist is Jillian Oedekerk from the OECD.
Great. Thank you very much. It's a pleasure to be here and to be part of the Health Datapalooza. I'm with the Organization for Economic Cooperation and Development, and that's an international organization. There are 34 member countries, and we work together on important policy priorities for government, and we make international comparisons so that we can all learn from one another. And that includes, of course, the important topic of developing countries' health information infrastructure and protecting privacy so that we can have data use in a privacy protective manner throughout the world. So the drivers for data use in healthcare have been well stated over the past couple of days. These drivers, including population aging and fiscal pressures, and the opportunity for better patient engagement and for discovery and research are universal throughout OECD countries. And the data that we need to make progress in this space, from what we've learned from investigating the development of health information infrastructure, is that it's absolutely vital to understand about patients' healthcare pathways and what are the outcomes so that we can do important work in areas of health system performance, improving quality and safety in healthcare, making important research discoveries, and making data and patient experiences and access to data better. And so what will be important is the ability to link data, as we've been discussing at Health Datapalooza, and the importance to take advantage of electronic data. And so this is why the OECD has gotten more and more deeply engaged in this topic of approaches to health data governance that includes protecting against loss, of course. And we don't need to discuss success stories. We've been discussing them over the past few days. They are numerous. There are many countries around the world that are leveraging their health data in a privacy protective manner for benefits for their societies. But many countries are not yet there in terms of what they're able to do with their health data across the OECD. They have the health data assets, but the data are resting in silos, although there are some excellent examples across the world. So let's just take a look at this for a moment. So we asked countries, what are their ability to link different data sets across these key forms of data that help us to develop an understanding of how patients progress through the health system and what kind of health outcome is produced as a result of that progression. So we have 22 countries that responded to this study, and you can see with the dark blue bars, many countries have the data available, and with the second bar, many have even a unique patient identifying number that enables the data to be brought together for projects of public benefit. But this lighter blue at the bottom of these sets indicate that there are very few countries, in fact, in the OECD that are bringing many of these data assets together to improve quality. Same here when we talk about will you be able to make use of data from electronic health records to improve quality in healthcare. And we've got large groups of countries that feel quite confident that they are going to be able to do this, but we also have a significant group of OECD countries that are not in this position yet. And they're at different places on the journey toward the development of privacy protective data use. So this is what I wanted to share with you, is that the OECD is working with countries to identify the key mechanisms that help to support better governance of health data so that good decisions can be taken about the processing of data that enable quality, performance, and science and innovation that help to protect fundamental rights to privacy and trust in government, while also protecting the right to health and to progress and scientific progress. Okay, what are these mechanisms very quickly? There's so much more than just protecting against breaches. You have to develop the information systems, as we've been discussing, and we need legislative frameworks that permit privacy protective data use. And just of note, the majority of OECD countries have unifying privacy legislation that protects all personal health data, not certain specific forms of personal health data. We need to be very open and transparent about how data is collected, how it is being used, and have good channels of communication with individuals and with society at large. Some countries in the OECD are accrediting or certifying large health data processors to ensure that they comply with the highest standards for data protection, as well as enabling access and use. And this can be a vehicle for progress. We need to be very clear and transparent about access to data. We see in some countries that it's difficult to know whether you can apply for access and what are the requirements, and that this should be publicly transparent to everyone, including data subjects and patients and data users. Data de-identification was talked about a lot earlier this morning. It's a key piece, but as you can see, it's only part of the puzzle. And it's very important when data de-identification practices develop that they do consider the big picture of data protection, but also the utility of the data for the purpose you want to put it to. So if you over de-identify, then you may ruin the data or bias the data research results, which brings us to how important these data security practices are to not only protect against data misuse, breach, and loss, as we're discussing in this panel, but also that they facilitate access and use of data in a safe way. And so I'll draw your attention. There are many things that countries are doing to protect their data, everything from ethical hacking to make sure their internal data security is secure against attacks from outside parties, a lot of training, not just of their own staff, but also of those who are getting access to their data, contractual arrangements with data recipients, legal penalties, as we heard this morning, and fines, and significant penalties for misuse, but also leveraging technology to enable privacy protective data use. It's not always necessary to transfer data, which is where the risks come in of data loss. Sometimes you can set up systems for secure data use that even provide real-time remote data access to approved applicants that don't involve the transferring of data, but create secure environments where data can be analyzed. These already exist in Canada, the United Kingdom, the Netherlands, and even here in the United States for some forms of data. So we have to keep monitoring, improving as we go along what governments are doing and move this space forward together. We're doing a lot of work we've already done, but just to wrap up, we're working together with governments, both officials in privacy protection and health officials, to develop recommendations that all countries could apply to protect their data while enabling health data use. So these recommendations on best practices in health data governance, and we hope that this makes the world a more unified place and more protective, but also more data use. So thank you.
Thank you, Jillian. I appreciate that. Next, we'll turn to Laura Vandross. She's the Assistant Director of the Division of Privacy and Identity Protection at the Federal Trade Commission. I think we have a short video. We want to cue that? Or?
But
okay,
not
sure.
Just yet. No, thank you, Kevin. So I'm Laura Vandross, and I'm at the Federal Trade Commission, and my colleague, Cora Hahn, was with you in the last hour and talked to you about mobile health apps and the work we're doing to provide business education in that niche space. But while we're talking about the subject of breach prevention and management, I wanted to just sort of zoom out a little bit and talk about the business education that we have provided to businesses generally on the subject of data security. And we, in the last calendar year or so, have launched an initiative that we call Start with Security. And it is a multi-prong initiative that builds on the lessons learned from about a decade of enforcement in the data security space. The Federal Trade Commission, under its Section 5 authority, Section 5 of the Federal Trade Commission Act, has brought to date about 60 enforcement actions against companies for failures to provide reasonable security to protect consumers' sensitive information. To reasonably protect that information. And out of those cases, certain themes emerged. And so in June of last year, we published a guide, the Start with Security Lessons Learned guide that is available at ftc.gov/startwithsecurity. And I have lots of copies that there is no table on which for me to distribute, but you can find it on the intertubes. And in that guide, we distill the lessons from our cases that really are basic lessons for businesses to apply regardless of the size of the business. And it's just the basics. So as an example to illustrate, we've discovered that businesses don't always think about what kinds of information they're collecting. So at the very outset, we recommend that businesses not collect information that they don't need, and to keep only information for as long as they need it, and to not use personal information unless it's absolutely necessary. And those, I suspect that I'm preaching to the choir in this room, but those are the kinds of fundamentals that we see coming up over and over again in the kinds of cases that we investigate and the cases that we bring. Supplementing our written guidance, we have a series of videos that we think can be used in any employee training, sort of business education effort by Better Business Bureaus, other kinds of groups. And I wanted to show the introductory video to this group. It's like 60 seconds, and we'll sort of mix things up here for just a moment. So if our IT folks, the multimedia folks can cue that up for us.
How can your organization keep sensitive data safe? Start with Security. More than just good advice, Start with Security is the name of an initiative from the Federal Trade Commission. It offers a variety of free, easy-to-use resources for building a culture of data security throughout any business. You'll find insightful videos, a written guide, blog posts, events, and more with valuable tips and tools everyone can use, from HR to IT to the CEO. All of these materials, which are available at ftc.gov/startwithsecurity, are free and in the public domain. You can customize them to make them appropriate for your company, no matter its size. Use them to train employees, hire vendors, educate business partners, keep developers up to speed, and much more. Start using and sharing the Start with Security resources today.
Visit ftc.gov/startwithsecurity.
So those actors sell it so much better than I do, but that is Start with Security, and we have the multimedia. And then finally, we also have been hosting a series of conferences around the country. We've had 3 so far, one in San Francisco, one in Austin, one in Seattle, and on June 15th next month, we will be having the 4th in a series in Chicago at Northwestern Law. These events bring experts in the field who donate their time to the commission and to the local business community to provide their expertise to local businesses to just partner and to provide tips, sort of businesses helping businesses to help promote security within the local community. And it has been a wildly successful program and has really sparked a continuing dialogue in those communities to help promote security. And we're really proud of that effort.
Great, thank you, Laura. Next, we'll turn to Jeremy Maxwell. He's a senior technology or technical advisor with the Office of the Chief Policy Officer in HHS, Office of National Coordinator.
Yeah, thanks, Kevin, and thanks to everyone for coming out today and everyone who is at home watching online. And I really appreciated Laura's talk about the focus on breach prevention and good security, cyber hygiene and best practices that the FTC is doing. And hopefully you'll see kind of a life cycle management theme in the presentations today. So rather than talk about prevention, what I want to talk about is breach preparation. And so, there's a couple variations of the quote that, there's 2 types of organizations, those that have been hacked and those that are going to be hacked, or those that don't know they have been already hacked. And so the theme that you can pick up from my talk is an organization's success in dealing with a security incident or dealing with a breach is already predestined before the breach ever happens. There are things that you can do right now today in your organization. It doesn't matter if you are sitting here from a federal agency, if you are from a healthcare provider, a small or a large healthcare provider. If you're a technology person, you can take these lessons back to your organization today and you can start preparing for the eventuality that you'll have a security incident that may rise to the level of a breach. And there's a couple of things that, that you can do. You can make sure that you have policies and procedures in place and actually sit down with people and work through what those are, right? Policies and procedures is not just having a document that you fire and forget, you put it somewhere and no one actually reads it, or you only remind them once a year during the annual training, and then everyone takes it Friday afternoon, 3 weeks after the due date of the annual training, and then they forget about it by Monday morning. It's actually sitting down with folks and going through mock drills, going through mock exercises. And this doesn't have to be formal. This could be just getting everyone around the table. If you're at a small organization, it could be everyone in your practice sitting down one day for an hour and talking through, hey, if we ever had something funny happening in our databases, or if we saw something weird in the audit log, Sally logging in at 3 a.m. when she didn't log in at 3 a.m., what would we do? What steps would we take? Let's brainstorm, what would happen if we were attacked by ransomware? Whose job is it to, be the kind of, front lines first responder in our organization to walk through these things? And if you're a larger organization, you make it a more formal tabletop or mock drill exercise where you actually, you want to let people know you're doing it, right? That is, that it is a drill, so you don't have, you don't instill panic. But you can pull in, your head of IT and walk them through a mock drill and actually do the escalation. So if as you're going through the drill, your head of IT says, oh yeah, at this point I would contact my PR representative, or I would escalate it up the management chain. Actually go through the steps and do that, and it will be enlightening some of the things where you may have gaps in your process. You know, a key stakeholder in your organization may be on vacation at the time that you're doing the mock drill, and you realize you don't have contact information for everyone that is key in responding to a breach. You may realize that you don't have the expertise in-house to do computer forensics, to do a really good job of understanding if a hacker got access to your system, what they actually did and where they went and what they had access to and what they did and what data may have left the organization. So maybe you need to, as part of your preparation activities, go through the vendor management process and obtain some of that expertise on retainer. You can have companies on retainer that it doesn't cost anything to set up the agreement with them, but then it's just an agreement that says, if we ever have an incident, you're going to be the ones that we call, and you can go and do that vendor management, that vetting of that vendor. You can get all the appropriate agreements in place. If you're a covered entity, you may need to get a business associate agreement with them. And you don't want to. The idea is doing this ahead of time, so then when you are in crisis mode, you're not trying to do these things. You're where you do have some deadlines and reporting requirements. You're not in crisis mode trying to figure out who's the best person to work with, the best cyber expert to work with, or trying to get an expedited business associate agreement in place. So if you do all of these things, then what will happen is if and when you have a security incident, you don't have to go into crisis mode. You've already developed your playbook. You just pull down your playbook, you open up and you start calling plays. And everyone is on the same page. Everyone knows what their role is and what they should be doing. And that's going to set you up for success if and when you have a security incident to be able to respond appropriately.
Great, thanks, Jeremy. Next, we'll turn to Nick Heasters. He's a privacy and security specialist supporting HIPAA compliance and enforcement within the, within the Office for Civil Rights.
Thank you, Kevin. Good morning, everybody. It's great to be here at Datapalooza. So we've had some good overviews of what it means to have a breach and protect data, and some good steps from Jeremy about a program to work on those different areas. So what I want to talk about is what it means to have a breach that's more specifically directed in a HIPAA environment. So HIPAA has a very specific definition for a breach. So we can see it's impermissible acquisition, access, use, disclosure of PHI, not permitted by the privacy rule, which is a presumption of a breach. And when that happens, you have to report that breach to various entities, to the affected individuals, to HHS, and if it was determined, or if you want to determine that that breach is not reportable, you have to go through a risk assessment. And that risk assessment is going to consist of 4 factors, or at least 4 factors. You can certainly consider other factors, but in the regulations, you have to at least consider these 4 factors. The nature and extent of the PHI that was involved, who the unauthorized person was that used the PHI, whether it's actually acquired or viewed, and what steps were done to mitigate the impact of that breach. So from the enforcement side, I work with the enforcement and compliance area of HIPAA. I wanted to talk about what we see as far as number of breaches and types of breaches that are going on currently in our environment. Since 2009, up until March 31st of this year, we have had over 1,500 reports of breaches that affect over 500 individuals. And as most people here might know, those are posted on our website so that you can see what those breaches were and some details about what actually happened to cause that breach. Theft and loss continue to be a large fraction of breaches. Lost laptops and mobile devices, over 55%. Hacking in IT now accounts for 11% of breaches. That has been going up year after year. Paper records, everyone still needs to consider paper in our environments, and those are still a large portion of breaches. As a result of these breaches, there have been over 222,000 reports of small breaches. Those are breaches that are less than 500 individuals since 2009. So just some graphical representations of what we talked about earlier in some of those statistics, just to show what types of breaches there are, how the theft and the loss, how that continues to be the larger portion of breaches, and how hacking in IT, where that stands, as well as a fraction of unknown and other, and some unauthorized access and disclosures. And from the sources of breaches, we can see that there are EMR systems, paper records still has about a quarter of breaches, desktop computers, server computers, laptops, and portable devices and email. Now, there are some issues that we see in our activities for enforcement and compliance when we do receive a breach report as to what some of these causes may be in a more specific manner. So one of those causes are insecure web applications, data leakage. If you go out to the website, you look at some of our resolution agreements, I think we have at least one or two out there where there are websites that were unsecure, whereby individuals could manipulate information in the URL or whatnot to be able to gain access to other folks' health information. So it's critical that there is some data assurance, some software assurance when these applications are developed, when they're put out there for access to individuals, to make sure that there is proper checks for authentication, authorization, access controls, so that this data leakage is minimized. Again, lost or stolen devices continues to be an issue. Workstations, laptop servers. We advocate looking at encryption for devices. It is one of the requirements in the security rule to address security of data at rest via encryption. And one of the things, obviously laptops, mobile devices are fairly portable, easy to steal and to lose, but workstations and servers, we even see that. So especially where you have maybe a smaller provider office or even a satellite office or a particular building of a hospital where thieves have broken into, or perhaps an insider event where it's not just laptops and cell phones that are stolen, but it is desktops that are stolen. It is a server closet that is broken into, and along with network equipment, routers, switches, a server might be stolen. So it is important to, and under the security rule, you have to consider encryption for data at rest in all of these situations. Not patching your data or wherever your applications, operating systems, making sure that you know where your vulnerabilities are in relation to various applications and pieces of hardware. Open source software, there has been many instances of organizations that leverage open source. Perhaps their IT department was not familiar enough with steps to take to make that more secure, that there were patches available through organizations that maintain that open source software, and that there were unpatched vulnerabilities, configuration issues which may have permitted data leakage or other unauthorized access, firmware on different devices, mobile devices, network devices, VPNs, routers, firewalls. Even though some of these devices their job is to secure your network, especially with routers and firewalls and such, they also have issues. And their manufacturers put out updates to their firmware that runs the devices when there are vulnerabilities discovered. So that is something that needs to be considered as you introduce these systems into your environment, that they do need to be looked at and updated. And that there's also an end of life. Just like Windows XP has been end of life, there's no more critical patches for that system. Many network devices also have an end of life where there will no longer be support from the manufacturer to update the firmware for those devices for security issues. Infections of malware, ransomware, that's one of the ones that's in the news. Most recently, advanced persistent threats, or APT attacks. So these are usually conducted by more on an organizational scale or more organized attacks. Their persistent nature makes it a little difficult to have your A game up. Since they are persistent, you really need to make sure that you have a good compliance program in place, a good security program in place, and that you do take your steps to reduce your risks and your vulnerabilities of your environment to thwart those attacks that are going to come on a persistent basis if an actor or an organized group determines that they have selected you for an APT-style attack. And also excessive permissions, lack of access controls, another area that we've seen where perhaps for ease of use, there may be a group of folks in a hospital or another office where it takes too much time to log into an EHR system, so I'll just make this spreadsheet here, and I'll tell my buddies about it. They can just go on the share drive, and everybody can see the health information of the folks that we see, and they can update it and whatnot. And there's no access controls, and there's no authentication as to who is updating that file. There's integrity issues, there's audit control issues, there's issues for being able to review who's modified and taken activity within those files. So we are seeing that a little bit more as well. So breach prevention, Jeremy did a really good job talking about that from a high-level overview, how you have to really be prepared ahead of time to prevent breaches. So this is some recommended steps. This is adopted from what NIST had put out as far as their security incident handling procedures. Again, to make sure that there is a plan in place. The worst time to respond to an incident is when it's going. You want to make sure that you have a team that's identified and involved and a plan on how to handle various security incidents. Doing your risk analysis, again, going back to those vulnerabilities, making sure those vulnerabilities that they are identified and they are remediated. Risk management, that process whereby you do update firmware, you do know where your health information lives in your environment, and you do know that there is open source or other types of software that needs to be looked at and modified and updated as appropriate. Access controls, we talked about that, and business associate agreements. So with respect to if a covered entity has entrusted their health information to a business associate, that agreement should look at and define processes and responsibilities for what's going to happen when there is a breach of PHI, what's going to happen when there is a security incident, and where those responsibilities are going to be for handling different situations in that management process. Recovery processes, we want to be able to prepare for incidents. We want to be able to know that an incident happened. We want to be able to identify how large the incident is, what that scope is, determine where the incident originated from so that we can have a localization of where we need to focus our efforts. If that incident has stopped, if it's ongoing, being propagated, and if it is being propagated, we want to contain that incident. We want to halt that propagation. We want to eradicate the issue, be it ransomware or malware, and we want to recover from the incident. If we had to restore data, if we have to do some type of, as Jeremy mentioned earlier, some type of forensics analysis to have a deeper understanding of what the actual steps were that the malware has taken within our environment, if it has in fact accessed protected health information, which might indicate that there could be a breach. We want to do that as part of our post-incident activities. So recovering from those breaches, HIPAA requires that there is a contingency planning process in place, that there are data backups that are occurring on a regular basis. Those backups should be tested to make sure that they are good, they will be effective during an actual incident. Disaster recovery plans, emergency operation modes plans, and making sure that you, again, know where your data is. Where is your data living? Who has access to it? Is that data critical to your operations? And if it is critical, once you've identified it, to make sure that it is part of your contingency plans, that you are able to recover that critical data. And we'll hold any questions until after the rest of the presentation.
Yeah, perfect. Thanks, Nick. And batting cleanup down on the end there, Ty Faulkner. Please, Ty.
Thank you all for coming today. I'm going to kind of wrap up or summarize a lot of what you heard from a business leader perspective. you know, it goes without saying, everything that you've heard is really policy, rules, regulations. I mean, even the title of this segment here, you know, pragmatic strategies to limit and reduce and manage, you know, breach. It's really high level. But what we need to do is we need to bring this down to a ownership level for the business leader or the organizational leader. And that means operational responsibility. And that's what I want to talk about today. And I'm going to use an example from a book that was written, when I was in master's school, called Execution. And there's 3 P's in the business environment: people, process, and product. And we need to look at this from the standpoint of the business leader in healthcare, and healthcare IT, and more specifically in privacy and security, and we'll approach it from that vein. So as a business leader, particularly in small corporations or small nonprofits, or just the doc in the box who's, you know, running a mom and pop family practice. My wife's the nurse, my daughter is in the med tech, etc. You know, I know everybody. We will never have a breach is the approach that most small practices have. But if you look at that pie chart, most of the activity is happening outside of the office now. The growth in breaches is outside the office now. The guys, you know, there's only a small amount of bad actors out there, right? You know, it's just like in the gaming industry. I did a project in the gaming industry to really try to catch the guys who were hitting all the casinos in Vegas, right? And we found out it was just a handful of folks, and we learned how to track them with biometrics and data, and we eventually curved the losses, the $1 million losses that were happening in the gaming industry. And it's the same thing we can do in healthcare, right? So there's just a fair amount of folks who are going to come after hacking events or events that will allow them to get inside of your technology. So when we look at the small practices, particularly in the rural communities, one of the things we have to do is we have to look at the people that you have on your staff, right? Are we hiring an IT person who has security background? Most practices have difficulty finding that person, so align yourself with local community colleges, local universities, who are training these folks on the privacy and the security rule, the breach notification rule, the enforcement rule. I actually think we need a 5th rule. We need a business leader implementation rule. We need an index, a progress index that actually shows what we're doing at a local level with implementing all of these other rules, right? So if we're hiring someone, we need to hold them accountable. So to what? To a process. We need to look at our processes. What are we actually doing to implement changes in our practice, right? What workflow changes, what safeguard changes, right? Administrative safeguard changes. Are we following those, right? That business leader, at that year-end performance review, this should be a line item on the business leader's review. What are we doing to make our data private? What are we doing to secure our data? What are we doing to create notifications of breaches? Yeah, you know, we might end up in a situation where we are part of what they call the B word now, right? The breach crowd, the wall of shame. But as a business leader, we have to stand up for that in our businesses. Even if it's an accidental event, it still needs to be reported, right? So we need to hold our processes accountable. And lastly, we need to look at what our products are that we're creating, like the talk that we've heard earlier about the multiple apps that are allowing potential breaches. Are we actually holding our developers accountable, right? So as a business leader, and again, particularly in the small rural practices where you don't think it's going to be an issue, no one's going to come out in the middle of nowhere to breach me. Well, you know what? When we talk about cybersecurity, it is not a matter of someone knocking on your door anymore. They're knocking on your door every time you turn on that laptop, every time you turn on your phone, and you have to be aware that I've got to have my people in place, my process in place, and the products have to stand their own when it comes to the bad actors out there, because they're out there to get us. So the business leaders, you have to take a hold of this and take responsibility, and I hope that your organizations, your boards are holding you responsible too. Thank you.
Perfect, thanks, Ty. So again, we have maybe a couple handful of minutes left before we break. So I definitely encourage anyone that has a question to come on up to the mic. I'll throw out the first question, really building off something that Ty said, and definitely open it up to others. And kind of moderator's prerogative, we'll use the Twitter rule. Your question has to be 140 characters or less just to keep things moving. And I'll try to stick to that as well. Ty, you mentioned kind of the workforce angle and the challenge of partnering with local community colleges. And I wanted to bring that back to something that I think Jeremy started off on as well, of kind of this notion of, a lot of small organizations, and even some of the large ones as well, are outsourcing. They're using third-party providers for different services, whether they be back office or actually direct support services. So are there specific practices or lessons that we've learned from successful examples of third-party relationship management around security and privacy that would be applicable in this space? And I'll open it to anybody.
Yeah, I'll jump out. Well, from 2011 to 2013, the ONC sponsored workforce development training. I personally am a professor of technology, and at my region in Michigan, we trained hundreds of students on creating processes for controlling PHI and managing PHI. We were able to get several of them hired either by an agency or by physician offices. So there's definitely a wealth of talent out there. You just have to kind of reach out to that talent and make sure that it is an item that's important to you. If you're going to hire someone that is going to take care of your patients, when it comes to the patient care, think about their data care too, because the data care goes longer than an office visit. If you're not putting someone in your practice that is looking at all the changes in the environment, I question whether or not you're actually practicing fair business rules now, because there's lots of doctors up and down the hallway that have people that are monitoring this process. And if I'm a doctor or a clinician and I'm not thinking that I am now behind my colleagues, then perhaps my business is outdated, and I need to step it up a little bit to make sure that I'm protecting the data.
Whether we're talking about business associates or more loosely, just third parties who are service providers to companies that hold sensitive information, one of the lessons learned in our Start with Security guide is to ensure that in contracts with service providers who are going to have access to sensitive information, that those contracts require that the service provider have reasonable security, and that the first party, so the business that is imposing that requirement on the service provider, really verify that the company is engaging in those reasonable services. And I'll give you an example of a case that we brought a few years ago. It was a company called GMR that hired a service provider to transcribe sensitive audio files, and some of those files included health information. But in hiring its service provider, again, to provide transcription services, it failed to require that its service provider implement reasonable security. And the result was that files that contained health information were available on the internet. So we brought a case alleging that the company had failed to require reasonable information security practices. And it was so simple what the company could have done to prevent this. Again, just a simple requirement in its contracts, such as requiring encryption, would have prevented consumers' information being available on the public internet.
Yeah, I think that's a really good point. And it's, in this world of, where so many companies are using third-party service providers, prior to coming to the public space, I worked in the private space, and we had literally 10,000 vendors that we used. And it's important to have those protections built in contractually and in the business associate agreement where EPHI is involved. But going above and beyond that, I think with vendor management, particularly when my organization's reputation is on the line, I think there's a good healthy skepticism to maintain. And it's not just requiring contract that you do these things, but it's actually requiring your partners to demonstrate that they are doing these things. And so that could be, they've had a third-party security audit or, something that they can give you to demonstrate, hey, don't just take our word for it. We take, this auditor's word for it, that we're actually doing what we committed to do in our contract.
I would just like to add that we've been talking about third parties as providing services to these custodians of health data, and that's one type of third party that's very important. But the other type of third party is the sharing or handoff of data to enable research or statistics that requires the integration of data. But the security concerns are the same either way when you're sharing data with third parties. But some of this sharing is what Health Datapalooza is all about. So how do you create the security environment that protects you and enables the data to be shared? And so just to add some things that are happening in countries which I haven't heard mentioned yet is if you're having a large data transfer that you need to make, you can do the security review of the receiving organization before any data is transferred, rather than what happens in some countries is that it's only after you discover there's been a misuse or an accident that then you discover that the security was inadequate or that they failed to respect the requirements in their signed contract. So you can protect yourself before the game. And again, as I mentioned earlier, sometimes data transfers, access to data doesn't mean you have to make a data transfer, so that you can look at alternatives of leveraging technology that allow third parties that need to access your data to do so without moving the data from your secure environment or from behind your firewall. So that's another way you can easily combine these different ways of protecting security to minimize your risk.
I've been given the 2-minute warning, so we'll actually try to do 2 questions in 2 minutes with short answers and short questions. Sir.
Great. Question to all the panelists, but maybe we can start with Nick. To what extent are you focused or concerned about the insider threat problem, sort of the Edward Snowden kind of scenario, where an employee inside the hospital or other organization compromises the data? And within that, are you and these organizations more concerned about data theft or violations of privacy, or are they sort of equal considerations?
Well, I think insider threat is a big concern. Before coming to OCR, I was a consultant, and I encountered that multiple times with some of the organizations that I consulted with, and I think that there is I don't want to say a misplaced sense of trust, but many of the organizations always thought that their employees were beyond reproach. And then when something happened, it was, how could this happen? And really, you need to take a holistic view. I mean, HIPAA does require that there are workforce clearance procedures that are in place to make sure that the people that are going to be authorized to access health information have appropriate training and they are actually authorized to do that as part of their jobs. And there are other training requirements that should happen as far as that employees would be able to hopefully recognize if there are issues or be able to report instances of security violations which could be a result of insiders that are accessing health information in an inappropriate way. As far as the second part of the question, what is more criticality of privacy of data itself versus some type of theft. Our stance on looking at things from an enforcement perspective is the protection of the data. Who is accessing the data? Is the data accessed by authorized people in a permissible way? And is the organization following the requirements of the privacy rule and the security rule and high tech? And if they're not, there could be a compliance issue in enforcement activities. Now, if there are instances of data theft that are uncovered as a result of an investigation, there is a criminal part of HIPAA, and that could be something that is referred to the Department of Justice for further investigation on the criminal side. But we'll take a pretty holistic view of the privacy and security of health information.
My question is there evidence of the security readiness of private sector health organizations outside of breach and outside of outreach and education, just to kind of stress test snapshot. How are they really doing? What's the real world look like out there? We had a conversation with one of our visiting guests about making it a part of accreditation, but I think it's possible to make judgments about this prior to a breach and as a condition of business operation.
I think to answer the question, yes, in certain respect for the business associates, for example, there was some great work published actually by one of our ONC counterparts there, Devin, out in the audience there, around where business associates are. That was about a year ago. There is ongoing work on trying to understand visibility-wise, where are the major sort of hot spots, if you will, pockets of activity by country that's being done in the industry. As we look at where the efforts can be stepped up, training, internal training in particular, we look at the types of breaches. Half of that pie chart we saw was theft and loss. So there is a huge effort right now to focus on tools for educating folks inside of organizations on how to limit the number of events within organizations as well.
Very good. So I think we've run over a couple minutes, so thank you for your questions and for your attention, and please join me in thanking our panelists.